a case-based discussion. We'll actually look at a very simple case. I'm sure you've all come across such a thing. So let's say we have a 78-year-old person arriving at the A&E with medical history of hypertension, diabetes, and smoking, and presents with crushing chest pain. Now, of course, the first thing you would answer is, what are the differentials of chest pain? You would look at cardiovascular causes, pulmonary causes, gastrointestinal causes, others, etc. So we'll try to focus on, of course, in this case, we'll look at the ECG. Let's look at the ECG of the patient. So they traditionally, conventionally, looking at the ECG, and it was diagnosed with ST elevation, with which suggests myocardial infarction, STEMI. You don't know about this. So this is, I take this as known, but the aim here is to jump into the application and see how this application can help us, the simulation can help us understand everything we learn from books. And the standard kind of diagnosis in this case was that there's occlusion of the LCA, as we will see in the 3D now, in the LAD, and it was anterolateral myocardial infarction. But of course, all this information can come from you reading books and trying to memorize a lot of this. But let's see how the simulation is going to help us. So I will pause my slides for a minute and jump into the simulation, as we said before. Hope you can see my screen clearly. Let me take this away. Take this down. So in 3D, we can go straight into, sorry about this, the simulation environment, where we will see the heart. Let's slow it down a bit. And we see all the action potential wavefront propagation going through the heart. And the ECG is recorded as we speak. So it is a live simulated ECG. This is not a playback. This is not a movie, so to speak. Now, let's jump straight into ischemia. I will get into some details later, but let's just, since we were looking at the case study, we want to go straight into the ischemia and infarction section. And here, it will show us this case that we were looking at earlier on, where we have an occlusion. You see this yellow dot, zoom in, and you see a gray area, which signifies represents the ischemic region in the myocardium. And here we see that there is an occlusion of the LAD, and we have something like 50% stenosis, you see here. And we see the ST elevation on the ECG. We can look at the 12 lead. Here you see the 12 lead and the ST elevation on the V1 to V5 and the V6 leads. And what we can see actually here is we have the control now to, you can actually move this occlusion from the LAD. Wherever I click on the artery, I will get a different scenario. Let's move the occlusion further down here. This is a smaller branch of the coronary artery here, the LAD. So now I see a much smaller region of myocardium ischemia. So I see my ST elevation has become a lot smaller. At the same time, we can look at patient examples of similar situations. We see the ST elevation, how it appears on patient ECG, on the V1 to V5 and V4 leads. And another really interesting thing we can do is bring up the torso with the leads. And this will help us really see why there is the ST elevation in which leads. Now let's see, I'll have to go back into making sure my occlusion is at the right place as it was before. Now the tutorial explains us step by step here what is the ST elevation and why the elevation of the ST segment happens in this case. Well, because of the ischemic cells have lost their ability to function like the healthy myocardium cells, they depolarize later. So the effect of late depolarization on the ischemic cells produces the elevated T wave. So it means that while the rest of the myocardium is repolarizing, some cells are still depolarizing. So that's why we have an elevated T wave in this case. And this picture here, the 3D picture with the leads and the position of the ischemic region can help us understand where to expect which leads should show the ST elevation more pronounced. If we advance the tutorial pages from next here, we will see that there is a case where there is the different positions of the occlusion. Here we have it on the right coronary artery here, for example. There's another example, and then a patient classic example where we see the elevation on 2, 3, and AVF. In this case, we can go back and look at the leads again. This time it will show us, we can see all the leads from here, actually. We can change them from here. So you can change the leads. And every time you see the lead and you see how the ischemic region is related to the lead in terms of 3D geometry. And that helps us, like understanding the 3D geometry and the time events in the heart helps us really understand ECG. Otherwise, without these tools, we just memorize ECG. We just try to create a memory map, where now we're creating a 3D image map in our mind. There's another example here where we have the posterior, the PDA artery occluded. So I will now, for a minute, go back to my slides and continue with a case where there's some complications of myocardial. Once we diagnose the myocardium in the STEMI, now we can see what the complications are. And of course, the most common complications are electrical, which means may lead to arrhythmias. So let's see what happens with this person. Patient receives angiography and PCI to open up the coronary artery. And later on, 48 hours later, appears with palpitations, dizziness, and overwhelming malaise. And then the further ECG is taken, and that shows that it's probably an arrhythmia. Now let's go back to the simulation now. And sorry, here, I'm gonna jump back to my simulation and go and take a look at arrhythmias. So let's look at the classic atrial fibrillation. Now here we see the atria and the fibrillation appearing, and we see the lead 2 ECG. Now we see, first of all, that we have a noise, a noise on the base, on the ECG baseline, and we have irregular rhythm. We can look at the 12 lead again, and we can confirm that the classic view of atrial fibrillation. Again, here, there is a tutorial that explains step by step how to recognize AFib, what are the characteristics, and treatment, prevention, and strokes, etc. Actually, there's a very nice one here. If we move on, right, it tells us, the tutorial tells us all the relationship between atrial fibrillation and stroke. So let's look at the stroke. There's a kind of simulation of the stroke effect here. I will see it's very fast. Actually, I have to slow it down. Let's slow down a bit. But again, I see the clot created on the left atrium, and it's traveling all the way up the aorta into the brain, creating the stroke. So I can jump from different part of the program to the other, or I can follow the tutorial step by step. trying to understand every concept and every point, and I can always go back. At the end of every tutorial, we have a multiple choice questions, which I can answer, and I get a score. And there's a lot more I can show you on the app, but I think the best way is for you to download it and access it with the logins that you have received, and send us your feedback. Of course, we really, really appreciate that. At the so I'm going back to my slides to say thank you, and I'm happy to answer any questions. So I think I left plenty of time. I think I left about 10 minutes.